Okay, hello folks, and welcome to Chapter 2 of your phlebotomy course. And this week we're going to be talking about medical, legal, and ethical issues. And we need to understand that in any profession, especially one that has a high level of responsibility like a phlebotomy technician, there are certain legalities that need to be understood in order to protect yourself from lawsuits and more importantly, to protect your patients as well. The first thing we'll do is define a couple of terms. First terms would be ethics versus law. So ethics and law guide behavior. Ethics are the knowledge of right and wrong. An ethical person has a sense of duty and responsibility towards others. He or she tries to do what is right. If ethics tell people what they should do, laws tell them what they must do. Laws are usually based on ethics. Government established laws to help people live peacefully together and to ensure order and safety. So when someone breaks a law, he or she may be punished by having to either pay a fine or spend some time in prison. Ethics and law are extremely important concepts in healthcare. Ethics and law are meant to protect people, and in our case, especially people receiving care, and they help guide people who are giving the care. Phlebotomy technicians and other healthcare providers should be guided by a code of ethics. They also must know the laws that apply to their jobs. For example, honesty. Phlebotomists should be honest at all times. Stealing or lying about the care you provided are examples of dishonesty. Communicate honestly with all team members. Protect the patient's privacy. Do not discuss the cases except with other members of the care team. Keeping patient information confidential is one of the rights protected in a patient care partnership, which is covered later in this chapter. All team members must keep patient information confidential. Keep staff information confidential. Do not share information about your coworkers at home or anywhere else for that matter. Report abuse or suspected abuse of patients. Help patients report abuse if they wish to make a complaint of abuse. This guideline is especially important to phlebotomy technicians who work in long-term care settings. Follow the requisition of your assignments. Report any mistakes you make promptly. This helps prevent any further problems. Reporting mistakes promotes the safety and well-being of all patients. Do not perform any tasks outside your scope of practice, which we had discussed last week. Report all patient incidents to the appropriate person, according to facility policy. An incident is any unexpected event during the course of care. For example, a patient who faints during a blood draw. Document accurately and promptly. Provide a written report of everything that occurs. Follow the rules about safety and infection prevention. We're going to cover this more in detail in chapters 4 and 5, which contains more information about these rules. Never accept gifts or tips from patients or patient families. It's unprofessional. Keep interactions with patients professional. Do not share or exchange personal information. Do not solicit things for the sake of personal business. Many organizations and companies have created a code of ethics for their members or employees to follow. These codes vary, but generally focus on promoting proper conduct and high standards of practice. If a facility has its own code of ethics, all staff members will be given a copy and are expected to follow it. To respect confidentiality means to keep private things private. Phlebotomy technicians will learn confidential information about patients that they're serving. They may learn about a patient's state of health and will also view information such as address, date of birth, telephone number. Ethically and legally, they must protect this information. This means phlebotomists should not share information about patients with anyone other than the patients themselves, the care team, and the patient's legal representatives, such as parents or guardians if they are under 18. Congress passed the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, in 1996. It's been further defined and revised since then. One reason for this law was passed was to help health information keep it private and secure. All healthcare organizations must take special steps to protect health information. They and their employees can be fined and even imprisoned if they do not follow special rules to protect patient privacy. Under this law, a person's health information must be kept private. Protected health information, PHI, is information that can be used to identify a person and that relates to the patient's physical or mental condition, any health care the person has had, and payment for the health care. Examples of PHI include a person's name, address, telephone number, social security number, email address, and medical record number. Only people who must have information to provide care or to process records should know a person's private health information. They must make sure they protect the information so that it does not become known or used by anyone else. This must be kept confidential. Remember, HIPAA applies to all healthcare workers. Fine and imprisonments are possible consequences for failing to protect patient privacy. HIPAA applies to all healthcare providers, including doctors, nurses, phlebotomy technicians, and other members of the care team. Phlebotomists cannot give out any information about a patient to anyone who's not directly involved in the patient's care unless the patient gives official consent or unless the law requires it. So some guidelines for maintaining and protecting privacy include the following. Make sure you're in a private area when you're listening to or reading your messages. Know with whom you're speaking on the phone. If you're not sure, get a name and number to call back after you find out it is all right to share information with this person. Do not talk about patients in public, like in elevators, grocery store areas, gift shops, lounges, waiting rooms, etc. Ensure privacy when discussing patient information with other care team members. Keep your voice low when discussing patient information with other care team members. Make sure nobody can see private and protected health or personal information on your computer screen while you're working. Log out and/or exit the browser when you're finished with any computer work. Do not give confidential information in emails. You do not know who has access to your messages. Make sure fax numbers are correct before faxing healthcare information. Use a cover sheet with a confidentiality statement. Do not leave documents where others may see them. Store, file, or shred documents according to your facility's policy. If you find documents with the patient's information, give them to a nurse or supervisor. All healthcare workers must comply with HIPAA regulations no matter where they are or what they're doing. There are serious penalties for violating these regulations, including fines ranging from anywhere from $100 to $1.5 million, and even prison sentences up to 10 years. Maintaining confidentiality is a legal and ethical obligation. It is part of respecting patients and their rights. Discussing a patient's care or personal affairs with anyone other than members of the care team violates the law, and penalties can be evoked even if the breach of confidentiality was unintentional. So it's very important to pay strict attention to these concepts. The Centers for Medicare and Medicaid Services, otherwise known as CMS, is a federal agency within the United States Department of Health and Human Services. CMS runs two national health care programs, Medicare and Medicaid. They both help pay for health care and health insurance for millions of Americans. CMS has many other responsibilities as well. One of those responsibilities is to oversee the regulation of laboratory testing in the United States. Passed in 1988, the Clinical Laboratory Improvement Amendment outlines the standards required of clinical laboratories testing human specimens, not including laboratories conducting research. The goal of CLIA is to improve patient outcomes by ensuring that laboratory tests are performed by qualified personnel and follow proven, effective procedures. Now, CMS certifies laboratories at a number of different levels based on CLI requirements. The most basic level is a certificate of waiver for facilities offering simple, easy-to-perform tests that have little risk of error. Tests such as pregnancy tests or blood glucose tests may be performed quickly and accurately even by individuals who have limited medical training. CMS maintains a list of tests granted waived status under CLI, and these tests are commonly known as CLIA waived tests. Phlebotomy technicians may perform these tests at some facilities. Many CLIA waived tests are what's considered point of care tests, meaning the testing is done near or in the presence of the patient. But not all point of care tests are CLIA waived. Not all can be performed by phlebotomy technicians. The highest level of CLIA certification is the Certificate of Accreditation for facilities performing moderate to high complexity tests. Organizations such as the Joint Commission can certify that a laboratory meets CLIA standards for this level, and CMS then performs a validation survey within 90 days. This process must be repeated every 2 years for a facility to maintain its accreditation. The American Society for Clinical Laboratory Science, a professional organization, summarizes the goals of quality laboratory testing in the following ways. 1. Perform the correct test. 2. Perform the test on the right person. Perform the test at the right time. Produce accurate test results. Achieve the best outcome. Perform the test in the most cost-effective manner. CLIA is intended to ensure that these goals are met. Phlebotomy technicians do their part by respecting their scope of practice, not performing tasks for which they are not trained, and following the facility's policies and procedures at all times. So for now, we want to discuss a bunch of common legal considerations in healthcare, including a bunch of terms that you should be quite familiar with within your career. So there are two types of law that deal with wrongdoing. Criminal law deals with offenses considered to harm all of society. Even though the victims may be individuals, the public is thought to be harmed by acts that violate criminal law. These acts are called crimes. Civil law deals with disputes between individuals, and violations of civil law are called torts. As described in Learning Objective 2, failing to keep a patient's protected health information confidential can have both criminal and civil consequences. Civil offenses, such as torts, deal with wrongdoing between individuals. Torts may be intentional, or they may occur as a result of negligence or inattentiveness. They can result in lawsuits against the healthcare worker and the facility. Healthcare workers who speak or write defamatory or untrue comments about a patient, for example, are guilty of the civil offenses of slander for spoken statements or libel for written statements. Such comments should never be documented in a patient's chart or spoken to coworkers, patients, or family members. Healthcare workers can and have been taken to court for such actions. Negligence and abuse are other possible causes of legal action against healthcare workers. Negligence is a civil offense describing actions or the failure to act that results in injury to the patient. An example of negligence is the phlebotomist unintentionally damaging the patient's nerves during the blood draw due to improper technique. Abuse, on the other hand, is a little bit different. Abuse is purposeful mistreatment that causes physical, mental, or emotional pain or injury to someone. Rough handling of a patient is considered abuse. Phlebotomists must never abuse patients and must follow all applicable policies and procedures to avoid possible harm to patients, as well as to protect against charges of negligence. All healthcare workers are mandated reporters, which means they are legally required to report suspected or observed abuse or neglect. The concept of consent is a very important legal issue in healthcare workers. Before a patient is treated at a doctor's office or a hospital, he or she must provide consent, which means they must agree to be treated. In most cases, a a facility requires a patient to sign a general consent form before receiving any kind of treatment. This general consent is considered valid for routine procedures. The general consent is considered valid for routine procedures, including laboratory tests and blood draws. Patient will not need to sign a new consent form for each routine service provided. General consent forms are usually valid for 1 year unless a patient takes action to revoke or take back the consent. This type of consent is known as informed consent. May also be called express consent, but these phrases have slightly different meanings. When a patient gives informed consent, he or she is acknowledging that she understands the treatment she will receive and agrees to receive it. Informed consent is a form of express consent, which means that the patient is able to actively, consciously acknowledge their agreement to treatment. A signed general consent form provides legal proof of the patient's informed express consent to routine care. More detailed consent forms are required for surgeries and other treatments that are not considered routine care. Even though a patient who sees a phlebotomy technician with orders for blood tests will likely have signed a general consent form, the technician should not draw blood or provide any care if the patient does not agree. Before providing any care, the phlebotomist must describe what will happen and answer any patient questions within his or her scope of practice. Any further questions should be referred to the appropriate care provider. Blood should never be drawn against the patient's wishes, even if that patient has signed a general consent form. Using words to threaten or coerce a patient to consent could be considered assault, which is the use of words or actions to cause another person to feel fearful or have fear of being harmed. Actually drawing blood from a patient who does not consent constitutes battery, which is the intentional touching of another person without permission. Assault and battery are crimes. A healthcare worker who even touches a patient who has not signed a consent form could also be committing battery. Sometimes a patient may not seem to consent to a procedure but not really understand it. This can create a situation in which the healthcare worker performing the procedure may be considered negligent. The patient has provided express consent, but the consent was not truly informed. Negligence is a civil violation. A healthcare worker on his facility can be sued in such cases. There are some situations that make a patient consent more difficult to obtain. A patient who is a minor or less than 18 years of age cannot consent to treatment. A parent or guardian must provide consent. Procedures should never be performed on minors without an appropriate adult present who has provided consent. Some adults may also require the consent of a guardian or designated caretaker. Adults who have intellectual disabilities or who have illnesses that affect their cognitive ability or ability to think and process information may be unable to give consent. An adult who is considered unable to provide consent will have a legal representative who can do so. If a technician has doubts about a patient's ability to consent, they should contact the supervisor. In emergency situations involving minors and adults, it can be difficult to get informed or express consent. The patient may be unconscious, in shock, or otherwise unable to give express consent, or a child's parent may not be available to provide consent. In these cases, patients may be treated under what's called implied consent. Although laws vary from state to state, the common idea is that the person is temporarily unable to provide express consent. Healthcare workers can provide care that a reasonable person would consent to in order to protect the life and well-being of that patient. In situations like this, it's very important for phlebotomists to follow their chain of command and provide care within their scope of practice and only as directed. Implied consent may also become important when a driver is suspected of being under the influence of alcohol or other substances. Most states have laws allowing police officers to require drivers to submit to some form of test for intoxicating substances when there is reason to believe the driver is intoxicated. In some cases, this may mean that blood draw is required. In states with certain types of implied consent laws, blood may be drawn even if the patient does not provide express consent. So just to recap what was covered over the last few slides, phlebotomy technicians must remember certain legal points. Care must be provided in a way that is never abusive or negligent. Healthcare workers are mandated reporters and must report suspected or observed abuse or neglect. Even with a signed consent form on file, a phlebotomist must not perform a procedure without a patient's consent. Verbally coercing a patient to agree to a procedure can be considered assault. Completing a blood draw against a patient's wishes is considered battery. Assuring patient consent may require extra steps in these special populations. Patients whose native language is not English. Required information in a language they understand. You may have to involve interpretive services that the healthcare facility should be required to provide. Patients who are minors, requiring a parent or guardian consent. And patient with, as we mentioned, compromised cognitive ability may require the consent of a legal representative, a guardian, so to speak. And again, in rare situations, procedures may be performed with implied consent. Emergency situations which the patient is unconscious, in shock. Emergency situations involving children without a parent or guardian present. Situations which a driver is suspected of being under the influence of intoxicating substances, and it's within your job's or your facility's scope of practice to draw these type of blood works. So, the American Hospital Association, or the AHA, was founded in 1998. Its goals include educating healthcare leaders and providing information both to the healthcare industry and to the public about healthcare issues and trends. It's a membership organization designed to serve hospitals of all kinds, healthcare networks, patients, and the communities in which the healthcare facilities operate. The AHA, American Hospital Association, not American Heart Association, also advocates with all levels of government, which means it expresses its opinions about laws that affect healthcare facilities and providers and their patients. In 1973, the American Hospital Association introduced a document called the Statement on a Patient's Bill of Rights and encouraged all healthcare facilities to use it, adapting it as needed to the patients they serve. This document outlined 15 rights to which all patients are entitled when receiving care and addressed issues such as informed consent, the expectation of privacy, and understanding the caregiver's identities and roles. Patient's Bill of Rights was updated and revised in 1992 and 2003. Patient's Bill of Rights was replaced by the Patient Care Partnership, which outlines the patient's care expected during the course of a hospital stay. Patients have the right to have and the responsibility to communicate something called advance directives. Advance directives are legal documents that allow people to decide what kind of medical care they wish to have in the event they are unable to make those decisions themselves. One type of advance directive is known as a living will, also known by various other names such as Directive to Physicians and Healthcare Directive. This document outlines specific medical care a person wants or does not want to receive. A do not resuscitate order, otherwise known as a DNR, is another type of advance directive and indicates that a patient does not wish for medical professionals to perform any type of cardiopulmonary resuscitation in the event of a cardiac or respiratory arrest. An advance directive can also designate a person other than the patient to make a medical decision if that patient becomes ill or disabled. This is called a durable power of attorney for healthcare, otherwise known as a healthcare proxy. During a hospital stay, hospitals usually employ medical social workers who are available to help facilitate these advanced directives, and they're also available to help with financial issues and other assistance a patient may require, such as social, emotional, and financial needs, and possibly follow-up care once they're discharged from the hospital. As mentioned before, the American Hospital Association has been deemed with the responsibility of educating healthcare leaders and the public about healthcare issues and trends, providing membership organization for hospitals and other healthcare facility networks, creating a Bill of Rights for patients that has been revised and updated many times over the years, and ultimately created a patient care partnership which replaced the Bill of Rights in 2003. According to the Patient Care Partnership, patients should expect the following. 1. High quality hospital care. This includes the patient's right to know the title and identity of any person providing care and to know if that person is a student, medical resident, or trainee of any kind. A clean and safe environment. This addresses the importance of infection prevention and control for patients, which will be covered further in Chapter 4. It also emphasizes the importance of communicating with the patient about any incidents that might have occurred or have an impact on his or her outcome. For instance, if a phlebotomy technician does not draw enough blood to accurately perform a test ordered for a patient, the patient should be informed of the error and the possible effects, which could include a delayed diagnosis. Patients should have direct involvement in their own care. Informed consent falls into this category. Doctors and other healthcare providers must thoroughly explain care, including risks and benefits. They must also tell patients if a treatment is experimental or part of a research study. Participants must agree to participate in these studies based on a thorough explanation. Doctors are also required to inform patients what might happen if they refuse a particular treatment or type of care. Patients also have the right to be informed about the likely cost of care. Patients have responsibilities related to their involvement in care as well. They must provide their caregivers with accurate information about their condition, symptoms, history, and insurance coverage. As mentioned before, patients should be presented with the expectation that their personal information will be protected to the highest standards according to the guidelines issued in the HIPAA laws. When a patient leaves a hospital or other healthcare facility after treatment, the facility should be able to provide information about any follow-up care needed. This may include training the patient, family member, or other caregiver about particular care procedures or about the use of prescribed medications. If there are follow-up appointments the patient must keep, the facility should inform the patient. And finally, a healthcare facility should help with billing claims. This category relates to insurance and payment of hospital bills. Hospital staff will file claims with a patient's insurance provider. If a patient does not have insurance, the hospital will direct him or her to possible sources of assistance. Again, usually with the assistance of medical social workers. So, as far as maintaining a patient's rights in a hospital or in any other healthcare facility for that matter, it's always best to remember the following guidelines. 1. Never abuse a patient. Abuse can include rough handling a patient during a procedure. It can also be verbal. Speaking abusively to a patient is a violation of their rights. Call the patient by the name the patient prefers. Use pronouns the patient prefers. He, him, she, her, they, them. Allow the patient to make as many choices as possible about how care is performed. For example, a patient may prefer that blood be drawn in a particular arm. Always explain a procedure to a patient before performing it. Follow all facility procedures regarding infection prevention. Respect the patient's refusal of care. Patients have a legal right to refuse treatment and care. Report the refusal to a supervisor immediately. Be truthful when documenting care. Never falsify reports. And again, do not talk or gossip about patients. Keep all patient information confidential. Following all these guidelines will assure a very successful career as a phlebotomy technician.